In his daily briefing, the governor also teased tomorrow's announcement about testing. He hopes it will help begin to address concerns about the virus disproportionately affecting communities of color. As LEX18's Mike Valenti reports, earlier in the afternoon, a Lexington council member gave voice to those concerns.
In a virtual special council work session Tuesday, Councilmember James Brown brought up a disturbing trend playing out across the country.
I continue to hear concerns about how the African American community is being disproportionately affected by the virus.
In Lexington, African Americans make up 15% of the population, but 30% of the city's confirmed coronavirus cases. Meanwhile, Hispanics or Latinx make up 7% of Lexington's population, but 6% of the COVID cases. The governor has suggested the alarming rates of infection in communities of color could in part be due to years of inequity and a lack of access to affordable health care. On the video call today, Brown noted that a substantial number of African Americans work for the city and are still doing essential services, putting their own health at risk.
What are we doing as far as city government to alleviate some of those concerns with some of our larger divisions that have a high number of African Americans working in them?
Those large divisions Brown was talking about are areas like waste management, water quality, and corrections. In his response, Deputy Chief Administrative Officer Glenn Brown used waste management as an example, saying they've started taking temperatures of workers every morning.
We're also making sure that these divisions, for those folks that are working, they have enough PPE to be able to go out and do the work on these trucks.
Mayor Linda Gorton also noted city officials have been meeting with African American pastors over concerns about these racial disparities. But it wasn't clear what concrete steps the city is going to take. In Lexington, Mike Valenti, LEX 18 News.